Revolutionary talk for revolutionary times. Promoting peace, liberty, and prosperity around the clock. LibertyTalk.fm.
Welcome to Living a Solution with Dr. Elena George. Today we have a really special show, one that I'm looking forward to, because it's an organ we don't speak about a lot, and that's the eye, one of the most important senses that we have. And, you know, there's been so many, and I think a growth of commercials on television that are leading us down the path of there's a medication that'll fix it. Nothing's ever natural. It just seems like it's just intervention. And I wanted to have Dr. Kondrot come on to speak today. He has a unique approach to healthcare of the eye. And I'd love for us to have a bigger view of what, how we can take care of ourselves. He's the past president of the board of the Arizona Homeopathic and Integrative Medical Association. It's a 27-year-old state association for licensed homeopathic medical physicians in Arizona and in other states. He's now the medical director of site.org. And his approach, I think, as a physician, and I would love to get his take on how he started, but most of us who are MDs came to natural and a homeopathic approach from a personal standpoint. And so, Dr. Kondrot, first I want to welcome you to the show. It's an absolute pleasure to meet you and to interview you today.
Well, I'm so happy, Dr. George, to be on your show. In fact, if you were with me right now, I'd like to give you a big hug for all that you're doing. I think your message is so important, helping so many people sort of find the right path, to their health and wellness. I started out as an ophthalmic surgeon, and I honestly believe that there wasn't one eye problem that I couldn't cut and put back together and make better. I mean, I was really surgically oriented. Then I developed severe adult onset asthma. I was taking 3 medications and almost died twice, even while I was on the medication. And one of the side effects of the medication is a tremor. And you can't be a good eye surgeon if you have a tremor. So then they told me to take Inderal, which, as you know, Inderal is a beta blocker. It will stop the tremor, but it made my asthma worse. And that was my life for a couple of years. So I felt there had to be a cure. I was healthy to begin with. I had no family history of asthma. I was a marathon runner, had good lungs. I just don't know what happened. So I consulted many doctors, pulmonary specialists, and they all told me the same thing. Don't stop your medication. Continue, listen to me, or you're going to have problems, with the typical medical doctor. So I began exploring different alternatives. And that's when I began to look at homeopathy. And I thought that homeopathy could cure my asthma. So the first remedy that the homeopathic doctor gave me didn't do a thing. So we know it's not a placebo effect. The second remedy may have helped a little bit. But the third remedy was like somebody hit a light switch. Not only did my asthma get better, my whole mental and emotional state changed. And that's when I said, why didn't they teach us this in medical school? Matter of fact, it's kind of funny. I went to Hahnemann Medical College in Philadelphia, which at one time was considered one of the top homeopathic schools in the country. So when I began to investigate homeopathy, I found that many ophthalmologists in the 1800s and early 1900s practiced homeopathy, if you can believe that. They utilized homeopathy right along with surgery. So that began my quest to really find out all I could about homeopathy and how I could incorporate that into my eye practice.
That's an amazing story, and it underpins what I said at the beginning, where it's usually a personal connection to it. And once you found that, I assume that became something that you took to the forefront for your patients, right? How did you translate what your personal experience was to your patients? Because most people think it's like you just described. It's cut, it's prescribe, it's, some sort of intervention to never fix the problem, really, just to manage it.
Well, I began incorporating it into my surgical practice, but I just was so much in love with homeopathy, I finally abandoned my surgical practice and just developed all alternative medicine for eye patients. And that was probably the happiest decision I ever made in my life, because I felt I was truly healing patients. I was getting to the underlying cause of their disease. And so many of my patients came to me, they were abandoned by traditional ophthalmologists. These doctors told them they have chronic eye problems like macular degeneration, etc. And their ophthalmologist said, there's nothing more I can do for you, or put your affairs in order. And these were the type of patients that began to find me. And it was such a pleasure to begin to talk to them about alternative treatments that could restore their vision loss.
When you think about macular degeneration, when people talk about it, it's a one-way street. You're just trying to, we've been taught, just hold it off. It's going to eventually be complete blindness, but you just kind of delayed the phenomenon. I mean, that's like a huge thing you're talking about, making is it a reversal? Is it just that you stop it, or do you fix the problem?
Well, I'd like to make a comment. This may come to a lot of shock to you and to a lot of the listeners. Macular degeneration did not exist before 1912. And your first thought might be, well, the ophthalmologist didn't have the technology to look inside the eye. But the instrument for looking inside the eye was developed in 1850. And even though doctors didn't have photography, they did exquisite drawings inside the eye and noted little hemorrhages and abnormalities. So what caused the onset? Because it really didn't exist. Well, what happened around 1912, margarine was introduced in Crisco. And there is a lot of research now that indicates that it was the introduction of seed oils that have caused macular degeneration. I'm talking about corn oil, canola oil, rapeseed oil, all the seed oils that you see in the typical supermarket. And another interesting fact, Duke Elder, who put together like a 15-volume book series on ophthalmic diseases, macular degeneration wasn't even mentioned in his book. So I think that, macular degeneration, they call it age-related macular degeneration, should be called food-related macular degeneration. So I think one of the most important things people can do, and I'm a firm believer of this, the longer I practice alternative medicine, the more I feel that even vitamins are not a good approach for a lot of diseases. I mean, there's really no shortcut. I think basically food is our best medicine. You are what you eat, and you really got to look at your diet. And I always joke with my patients, if it has a label on it, you probably shouldn't eat it. You got to eliminate those seed oils too, and look at putting healthy food into your body. But getting back to your question, can we reverse it completely? Well, most cases that I see, we can improve their vision, but in many cases we can reverse it completely. But macular degeneration is kind of like an aging change. So as we get older, our face may start to get wrinkles and we lose our muscle strength. We can begin to do things to reverse the aging process, and that's why I like to look at macular degeneration. We can reverse it. We can stimulate and wake up those dysfunctional retinal cells and help improve vision. So the majority of patients that I see, we can make their vision a little bit better and hopefully get them to the point where they can function and enjoy life and all the activities that they have a passion for.
That's wonderful. I have a question about the pathophysiology. What is it, do you think, about the seed oils is it inflammation? What's the root cause, do you think, of why it causes so much damage?
Well, it's the linoleic acid and the pharmacology of that. The linoleic acid is toxic, and I believe it does cause vascular changes, decrease in circulation and inflammation, as you mentioned. Interestingly enough, in a lot of the early cardiology books that were written in the early 1900s, they did not even mention coronary artery disease. It was casually mentioned as a rare phenomena. Most of the cardiology books written in the early 1900s dealt with valvular problems or congenital heart disease. Can you believe that? So I
Wow.
think coronary artery disease is related to seed oils in our diet. We are slowly poisoning ourselves with the American diet.
I mean, I've heard of a lot of different cultures when they're fine in when they eat their foods, but when they eat the U.S. diet, from the Native Americans on, it causes disease. So there has to be something that
Oh
really,
yeah, look at the American Indians. They were probably the healthiest people in the world, and then as they started embracing the American diet with processed wheat and sugar, the seed oils, and there's just the obesity and diabetes just skyrocketed in our population.
well, with that in mind, we, again, this macular degeneration is probably one of the ones that we hear the most about, but we don't hear so much about glaucoma, but it affects many, many people. Many of my family members had it, for example. Is there some sort of nutritional aspect to that, or is it genetic?
Well, glaucoma is a very serious eye problem, and I think the general ophthalmologists are approaching it the wrong way. The problem with glaucoma is you have an increased intraocular pressure, and it damages the optic nerve of the eye. And where the nerve enters the eye, that's the weakest part of the eye. So if you imagine a basketball, if you put too much pressure on a basketball, it's going to kind of split at the seam. That's what happens with glaucoma. The pressure goes up and it causes a decreased circulation in the optic nerve. So the analogy I tell my patients, imagine the optic nerve is a garden hose, and you put your foot on the garden hose, you're going to decrease the circulation. So there's two things you can do. Number one, get a better garden hose, increase the flow of water going through that hose, or take your foot off. So most ophthalmologists, all they do is tell patients to lower the pressure, either by drugs or surgery. They don't talk to them about what can you do to improve the health of the optic nerve. So that's my focus. And of course, improving the health of the optic nerve is number one, reducing stress, meditation, deep breathing, positive affirmations. Studies have shown that reducing stress can improve the circulation of the optic nerve. Also, exercise. Studies have shown that maybe doing 20 minutes of aerobic exercise a couple of days a week can lower the intraocular pressure. And then the other key is changing your diet to reduce the arteriosclerotic changes. So I think if you use that approach, so many glaucoma patients can benefit from this instead of just taking eye drops to lower the pressure and ignoring the end organ. Then there's the homeopathic approach. In homeopathic literature, there are many, many articles written how homeopathic remedies can reverse glaucoma damage. Also, light therapy. Now, if you would ask the average ophthalmologist, hey, doc, can light therapy help my glaucoma? He'd probably laugh at you and say that there's no evidence-based medicine. And that's another topic. Don't get me started about evidence-based medicine. But in 1948, in the American Journal of Ophthalmology, which is one of our top peer-reviewed journals, there were two articles written how light therapy can lower the intraocular pressure. But, ophthalmologists, they just ignore these alternative treatments. They just ignore it. They're just driven by big pharma. And it's really a shame. It's really a shame.
I would agree. On that note, let's take our first break and come back. You're living in the solution. Welcome back to Living the Solution. We're speaking with Dr. Kondrot, and you can go to his website, healingtheeye.com, and there you'll see testimonials from his patients and learn more about what he does. So before the break,